Hi, I'm Candace with Slusher Home Care Consulting, and I want to talk today about infection control in the non medical home care world. I think you've heard me say this before, but a lot of times people don't quite take us as seriously, maybe, as they should. But especially if you have a licensing board, if you're licensed by the state, when you sign up a client, you do have a limited responsibility for their well being. And while we don't have control, that's actually kind of a myth, right? But we do still need to be monitoring our clients and their well being and paying attention to infection control is an important part of that. And it was even before COVID, but now it is it's a more highlighted topic, right? So let's talk about that. It is something truly that every agency needs to address. Um, at a minimum, your staff need to be trained per OSHA requirements on bloodborne pathogens, which include hepatitis B and HIV, as well as universal precautions, hand washing, clean procedure, cleaning up after any sort of bodily fluids, that kind of thing. That is the absolute minimum that needs to be done. And typically that is done upon hire and at least annually or when anything new arises, right? There was a lot of talk about infections when COVID first hit and ongoing. So most of us have really improved or increased our infection control policies. They are much more robust than they were before. So at a minimum, your infection control policies should address the following, okay? Reporting or even just logging any infection contracted by your clients for the sake of tracking the well-being of your clientele. And also that is information that you'll use during your quality assurance or QAPI meetings that are done typically twice a year. Policies also need to address protocols for staff to prevent them from getting sick themselves, but also to prevent them from contaminating or reinfecting a client. If they did get it from the client, do they then take that germ back to them? And primarily, you're going to be using PPE and universal precautions for those kinds of things. You need to address source control. Where do the germs come from, right? Hospitals, waiting rooms, grocery store, anywhere they could be. How could we reduce or prevent that infection from happening to begin with? Do you have enough PPE to protect your staff and clients if another wave hits or if a new disease arises? PPE is a big part of source control. So that is why it is so important for every agency to have a good staff of, a good supply of gloves and masks, gowns, hand sanitizer, all those kinds of things. And per the CDC, you need to be monitoring community transmission levels on a regular basis, at least, once or twice a month, maybe even weekly, especially if you're in the more urban areas where the populations are greater. You need to be monitoring the community transmission levels through your local health department to determine what the risk might be for COVID or, again, any other communicable disease that is that everybody's talking about right now. What kinds of things are we going to report or log? Well, client infections, like I said, any client infection, not just a communicable disease. So that's urinary tract infection, respiratory infection, a sinus or ear, nose, throat, ear infection, strep throat, a skin infection that could occur after somebody gets a skin tear, maybe bumps their arm on the wall or the door, shingles, intestinal infections like C. diff or hepatitis even, okay? All of those things need to be monitored because they're going to help you track and see the general well-being and sometimes decline of your clients. That goes a long way in helping your staff and the families, to maintain this client safely at home. And then for staff, for staff and clients, any infectious disease or communicable disease, the kind of stuff that the CDC talks about. So you want to mitigate the possibility of spreading infection to staff from clients, to clients from staff, vice versa, family members, and so on. So that includes COVID-19, obviously. The flu comes about every year. That is a communicable disease. That's why there's always the things that are going around. Tuberculosis, monkeypox, A few years ago, it was Ebola. Whatever the CDC is talking about needs to be on the list of both clients and staff need to be tracked for those things, but all infections for clients need to be tracked or logged or documented in some way. You need a record of these. You need to know how you learned about them, what the prescribed treatment was, and maybe any outcomes, for clients or staff. Before also, but especially since COVID, here's some extra things we need to be making sure that your infection control policies cover. So adequate PPE and inventory. Not just that you have enough, you really need to have enough for your staff and clients to use 2 weeks worth of PPE should, again, another wave come up or a new disease come up. And we learned the hard way, there was not enough to go around at the beginning. And so you've got to have those things on hand, and you have to have a process for how you're keeping up with the inventory. So are your staff letting you know on a weekly basis when you're running low? Somebody needs to be monitoring that and paying attention. Do we have enough at all times? Where are we getting it? Do we have more than one source to get it from? That's important. Maybe a local store and online. You need to be looking at those. Fit testing for N95s or respirators. That includes a mini respiratory protection program. Now, I have a sample of a mini respiratory protection program that is specific to non-medical home care, and there is a sample of that on my website. There'll be a link below here for that free sample. There's no cost for it. I didn't write it. It was written by a government agency, but I did tweak and edit it to fit home care needs, and that should make sense to you. So you're welcome to follow that link and download that. Your policies also need to include coordination of care with home health, with medical home health agencies or hospices, with hospitals, with physicians, maybe even your emergency services locally, some sort of how are we going to coordinate what's going on, okay? In airborne diseases, respiratory droplets are the source, which is why PPE is so important when you're doing source control. I hope that makes sense. Now, fit testing for these N95 masks is an OSHA requirement to ensure that the airborne particles cannot get around the chosen mask. And N95 masks are considered respirators. Whether or not they have that little valve, they're still technically a respirator. Therefore, when staff are using N95 masks for the purpose of preventing infection, maybe with somebody who has COVID-19 or a communicable disease that is airborne, they need to be fit tested prior to using that mask in order to ensure that the mask is even doing its job, right? There's been all kinds of discussion about that. Do the masks even work? Well, if they're loose fitting or they don't fit or they come off when you're talking, well, then they don't work for sure, right? Providers can make sure that only employees that are seeing infectious clients or COVID positive patients are using the N95 masks to limit the number of employees that have to be fit tested, but also to save you a little money. You don't want to just send everybody out in N95, whether they need it or not. That probably wouldn't be fiscally smart. And you can do the fit testing yourself using the guidelines from OSHA. It's on their website, pretty easy to find. Actually, you can Google that. Now, many agencies are still screening for COVID symptoms prior to any client contact, even though much of the country has sort of relaxed these rules. But in order to continue to hold your staff and your clients accountable for their own health and to reduce the potential of spreading infection that they might have, that's really why people can keep screening, because as soon as you stop asking them, they're going to forget, and then it's back to, well, maybe this was just an allergy symptom and I didn't think about it. So then when somebody gets sick, there isn't anyone to hold accountable. And that doesn't really work. Sometimes we just need to remind people, just poke them a little bit with that pre-screening. Hey, making sure you're not sick today, nothing wrong with it. And if you already have that system in place, then just keep doing it because people are used to doing it. If you don't, you might want to consider reinstating that again, because if somebody gets sick, you won't be able to trace anything. You won't know what's going on, and that could get out of hand pretty quick. So your policies then would address the screening criteria and agency actions when a screening question is answered yes. What's going to happen then? Now, if someone does come up positive for COVID specifically, these are the things that need to be documented in a report. Okay. All COVID-19 positive cases in clients and staff should include contact tracing. And that means how many other caregivers or clients are potentially affected by or exposed to, this disease. So if it's a client that's positive, how many caregivers have seen them since they were potentially exposed? How many other clients have those caregivers gone to see, and so on and so forth? Hopefully it's a very small number of people that are affected, but you got to look at it. You've got to pay attention and notify the people you might have been exposed. Please monitor your symptoms and test as necessary. Whether or not your agency can even continue to service this client during the infection, right? If it's a client that has an infection, is there staff that's going to take care of it? And what else is happening for that client if it's not your staff? What are the plans to return to work or to resume service? Is it a certain number of days? These days, you don't necessarily have to wait for a negative test, just so many days. You're going to follow the CDC guidelines as those continue to evolve. Were there any hospitalizations or deaths as a result of this positive case? And then, of course, you must report it to your local health department. This is also part of the CDC requirements, which are updated pretty regularly. And then lastly, we always have to follow OSHA. That is the default, right? I'm in Texas, and our government hasn't been just real aggressive about monitoring this disease process. So we are just defaulting to what CDC and OSHA requires. Whatever they're doing, that's what we're doing. So the OSHA General Duty Clause, again, has always been there. A lot of people didn't bother to pay any attention to it until this, pandemic happened. So what it says is, each employer shall furnish to each of its employees employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm to employees. Now, most people only look at this in an industrial setting. Maybe they're in a factory where there's potential dangers. But a place of employment that is free from recognized hazards could be a home where somebody's known to have an infectious disease. So that does apply to us. And each employer shall comply with occupational safety and health standards promulgated under this act. And then it also even specifies that each employee shall comply with occupational safety and health standards and all rules, regulations, and orders issued pursuant to this act, which are applicable to his own actions and conduct. So basically saying the agency or the employer needs to be mindful, pay attention, make sure you're only sending employees to safe environments, and to mitigate any potential risk as much as possible. Now, this general duty clause covers all infection control training and measures, as well as emergency preparedness standards and procedures. It's up to the agency how these are handled. But you or the agency will be held accountable if an incident occurs and is investigated by OSHA. They want to know, were you doing these things? And if so, why not? So, no excuses. When you know better, you do better. I do always recommend that you check regularly the cdc.gov website and even the osha.gov website at least once a year. They don't change those things real often, but there were the temporary standards during the height of the pandemic. So keep those, save those links, keep them, pay attention to infections, pay attention to your clients being sick and your caregivers being sick. It's a lot more now than it used to be. It used to just be, well, if you're sick, don't go to work, right? But there's more to it now, isn't there? Lots of risks, lots to manage. I hope this was helpful for you. Thanks.